The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu. Today I have two co-hosts. I have Otto Lohse, who is a longtime volunteer with Project Independence, and Paula Ewell, who is the Deputy Commissioner of our Department of Services for the Aging. We do all of the good stuff together. I'm so happy we have our very intimate studio today. We're all together, and we are interviewing Jeanne Cacciatore, who is an LMSW, the Program Director at Family and Children's Association for the Mental Health Awareness Training Program and the Safe Observant Senior Program. And we're talking all about mental health first aid. Jeanne, thank you for joining us.
Thank you for inviting me.
You know, this show, if anyone listens every week, we give updates, and I was raving, I should say, about your training. It really was. It was such a wonderful thing. You know, we had the pleasure of all being trained, and it was our social workers, our nurses, and all of our Department of Services for the Aging and even community services joined us too. And Jeanne was such a great instructor, and it was such an important topic. You know, I think certainly on this show, and Otto can vouch for this, we're constantly talking about mental health. All things kind of lead to that.
Well, I found the term, first of all, to a non-professional social worker, mental health first aid is one that doesn't really register with me as something I hear every day. I mean, I hear about first aid, you cut yourself, you have a heart problem or a stroke or who knows what. But mental health first aid is different to me. So maybe elaborate.
Yeah, like what is mental health first aid? I think is the where to begin.
I think that's a great place to begin. And that's a great question, Otto. So as first aiders, without mental health for medical issues, it's not that you're going to perform the brain surgery, but you might need to learn, you know, how to give mouth-to-mouth resuscitation or something in the moment, and then help the person get to the professional. So it's the same with mental health first aid. It's not designed to be clinical for people to treat and diagnose people. It's to recognize signs and symptoms, catch things early in the early stages. Here's a question for you guys. How long do you think it takes for a person when the signs and symptoms first show up until they get into treatment?
I have no idea.
Yeah, throw out something.
Quite a while.
10 years.
Years.
Because I learned that in the training. I didn't want to steal everyone's thunder. 10 years.
10 years is about an
From
average.
start to getting the right
to actually getting treatment.
Yeah.
And
diagnosis.
I do have, you know, I may get to the story about my own child that had some issues that I didn't always recognize, and I thought I could, you know, discipline it out and blah, blah, blah. And then eventually you want to watch things if they're getting more severe and hopefully not into crisis mode. So mental health is such a broad spectrum, right? And so we're learning to recognize the signs and symptoms and how to respond in helpful and unhelpful ways. And that this topic goes so deep and wide that when you hear that it's 6 hours, people are like, whoa.
Right.
Let me ask you guys, did you feel?
No,
like
flew by.
Yeah.
It flew by.
Well, I mean, think about it. First thing is, what caused it in the first place? Was it alcohol, drug, or genetic, or who knows what?
Or everything.
Yeah, right.
If it took 10 years, it started somewhere.
Well, like I remember asking that question in school about like genetic components. So think of it like a cancer. If cancer's in your family, you might want to just be a little more aware and go for that extra testing and think about it. It doesn't mean everyone whose family member had cancer is going to get cancer, but there could be a genetic component. And then the environmental stressors could bring it out and make it more severe. So it doesn't mean, you know, it can be just like a medical issue.
Right.
Did I answer about the first aid? Do you get it now? That
yes, I do.
Okay.
I mean, you want to react to the problem, but not necessarily be the one who fixes it.
exactly.
Perfect. See, he's
Good,
a quick
Otto.
study. He's a quick
Yeah.
study, that Otto.
And the early intervention, the early recognition that something's wrong, the early you can get the right intervention. And hopefully it's
Yeah,
not
and
a
it's like if
10-year
somebody has a
span.
stroke, the sooner you
Right.
get somebody
Right.
there that can help them, the better for that person.
Exactly. But you just said a word that I want to talk about for a second, the right help.
Right.
And it's tricky.
Yeah, very
It's
tricky.
there are a lot of different types of providers, and we do go into that in the course, and we talk about what kind of questions you should ask when you're getting your treatment, because there are a lot of things out there that might not be the right fit. And Kristina likes my little phrase that if you got a bad haircut, you wouldn't stop getting your haircut. You would just go to the next hair salon or the next stylist.
Yeah, it really hit home because I've heard that, I've certainly had people, my friends and my family members who say, I tried therapy and it just didn't work for me, and it was just, they just didn't mesh with whoever their therapist was, and it really struck with me, and I could certainly relate to it because, I'm going to get my hair done.
Right.
I mean, it's true of everything in life.
Yeah, right.
A hearing aid, you get your car fixed, you go to the dentist, you go wherever you go, you need the right help.
Yeah, but with
And
therapy,
always
you also have to know to participate. And I think some people, the sense is you just go.
Right.
And the therapist is going to tell you do X, Y, Z, but it's
right. You have to do the work in it too. And I think
Sorry
that, like with so many things, you just don't want to, because it makes it all that, whatever your reason is, all that more real, or you just don't want like the so I think that that's what the hesitation is so often. And as you said, even yourself, and I loved when you really shared that it was a journey for you to find the right fit.
I hate to say how long it took. I really do. It's almost embarrassing. And I had to keep looking at myself saying, is it? And then I would find someone that I didn't think was the right fit, but I'd say, maybe it's me. I got to stay and let me try. And then something would happen that I knew was blatantly not the right fit.
Just to backtrack for a second, what I'm hearing here is that you have a program that takes 6 hours that anybody like myself could go to get mental health first aid training, basically, or knowledge. So within this training program, you cover a lot of things. Maybe kind of give like an overview of what,
We talk about some statistics and the impact of mental health on us all and how far and wide that is. It's not just the individual. It affects their families. Who else it affects? It affects the jobs. It affects the economy. It affects how we spend our money, where we're putting our value. Okay, so we talk about those kind of things from the beginning. We talk about the recovery movement. And when I say the word recovery, most people think of what?
Alcoholism, drugs.
Yes.
Okay, but there is a very large population of people in mental health recovery. We talk about the peer movement. People with lived experience now can get certified. So different
jobs,
similar to AA sponsors. However, AA sponsors raise their hand and they become a sponsor. Certified peers have to get a certification. It's from the Peer Academy, and then they can go with that certification and get paid because of their lived experience. And it's growing at FCA, which is my host family, my agency. We do hire peers, and we are getting it more and more. We do have a recovery center that's for substance use, and they do, many times we don't know what came first, right? Did the mental health issue cause someone to self-medicate and become addicted to drugs, or did the drugs and being addicted cause some mental illness? And it's not always that easy to define. So that's another thing we talk about. Then we go on to talk about recognizing the signs and symptoms. We take each piece of the diagnosis and the words that you hear out there and go a little further. That word psychosis is very tricky for many people. And there's 3 ways that, and probably more than 3 ways, but the 3 ways we focus on that are psychotic. And let me define it unless someone wants to say it.
No, it's all you.
Okay. A psychotic break is just a break with reality. Okay. So that can come in the form of a delusion. So your thoughts are not based in reality. And it can come from a hallucination or manifest as a hallucination where your 5 senses. So you're seeing, tasting, hearing, smelling, feeling something that's not there. Okay. So that's what psychosis is. And it's not really its own diagnosis.
Right.
It is actually a condition that can come from other things like substance use, like a mental illness, and many times we correlate psychosis with schizophrenia, which happens to be one of the symptoms. Schizophrenia itself means thought disorder, but many people who have that diagnosis do have psychotic breaks. We have an activity where we simulate an audible hallucination. We watch a video of someone who's having a psychotic break and what friends are trying to do to support that person. We have another film, we talk about depression. Then we infuse this whole training, because we're saying it's the older adult model. We infuse it with information about dementia, Alzheimer's, how substances affect aging bodies, how to age successfully, right? We talk about the stigma. That's a very big part of this program. We really want to reduce stigma. And the question may come up about younger people, and I don't think the stigma is as horrific as it once was. So I think that it's talked about more. People are taking care of their mental health. It's not uncommon. I have adult children. They see therapists, their friends do. They really.
Would this be good for, like, you're the person who identifies that somebody within your family you think has a mental health problem, right?
Yes.
So that person obviously would be good to go to this kind of training.
Oh,
Yes.
absolutely.
But would the person who you think is the one who has the mental health problem also be somebody who could go or should go to that kind of program?
I'm very glad you asked that, because that has happened. And if a person, some of the problems that with mental illness is that the person that's experiencing the symptoms doesn't recognize it as an illness.
Right.
There's no blood test.
Right.
You can, like you test your sugar, you test your cholesterol.
Right.
But if somebody, it's open to anyone. And I've had people sitting in the room sharing that they had a personality disorder, sharing that they had a bipolar disorder diagnosis. We talk about the language to use. So that person is welcome, because I don't think we're trying to engage everyone and understand everyone, and we don't make anyone feel.
No, and I think,
bad
as you
about it.
mentioned, when you said like it reduces the stigma. So, the person that's suffering, and might be confused and not know what's happening. I think taking this course and hearing about it helps reduce the stigma for yourself, and maybe make you more willing to seek help or, to talk about things. So I think it certainly is a class that is beneficial for anyone.
I wouldn't say it's created for the person going through mental illness, but they're certainly welcome, because we're not going to talk about like I go a little deeper, and I share a lot of my experiences with families whose loved ones have mental illness and haven't been getting treatment.
Right.
And that has been a big gap in society. I have recommended readings, awesome books. One of them called I'm Not Sick, I Don't Need Help.
I know, I actually marked that down because I'd love to get the author on the show.
I am
Because
not sick.
I think he just sent us something. I'll have to send it to you.
That would be great.
Xavier Amador,
Sure.
Dr.
Yeah.
Xavier Amador has put together the LEAP method for people whose loved one, instead of fighting and battling and you need this and you have to go there.
Right, yeah.
It's a way to really have a better relationship and communication.
Well, it's like hearing, all right? I always say that people who don't want to get hearing aids or whatnot, they really don't know what they don't hear.
Very good.
I
can take Otto along.
I know, he's got a he can have you all day with his little catchphrases.
But people who have a mental health problem, I think some people realize
Yes.
that they do.
And it depends on the
they
illness
have
Right. There's
they
such a
realize
gamut
that,
of
they can't do what they did, and they know that they forget, and that they just know. And
Yes.
some people you can talk with, I think, about things like that. And then there are others who will be in denial, like, I can't hear. No, you can hear. Yeah, I can hear. That kind of thing.
Right, because
Like-
they didn't hear what they didn't hear, so they didn't know they didn't hear it.
Yeah, well, I'll give you a perfect example. When I first got hearing aids, I didn't realize water made noise when it came out of a tap. I didn't hear it.
Wow.
So to me, the water was, it just comes out of the tap. It doesn't make any noise. I didn't realize there were so many birds on a golf course.
great.
These are things that, mental health wise.
Yeah, no, it's a great
that's
little correlation.
Like when young children, when I say to my son, he had social anxiety, right? So he probably didn't realize that walking into the secretaries at the high school maybe he didn't realize that everyone else didn't feel the pain in his
Right,
in your
yeah.
chest about it, and that he was just
I just think it's
supposed to
normal.
Right.
pummel
Right.
through that because he
Yeah.
doesn't know. And it's very similar to what you're saying. So that's why it's hard to diagnose. And
Yeah.
people, our society is really set up for that person to identify and know and go for help. It's, with children, you can take them, but adults have to go on their own, and it gets very tricky.
Yeah, but even children, like you said, with your own son,
Mhm.
you see it. We've had the same issues in my family, but you really don't know if it's not really flagrant,
Mhm.
and it's kind of gradual, like social anxiety. Maybe they say, "No, I'm not going to go to class today." Why? Because I have to get up in front of the class and
Yeah.
talk about
Right.
something.
Yeah.
That's a form to me of social anxiety.
Well, honestly, that's more the fear of public speaking.
Yeah.
Okay.
My son could probably speak, and he started doing that as a young boy. He was a dinosaur expert from like
Right,
5 years old, and he would talk to his class. He could talk about academia. It's the
Social
social,
component.
it's the
right.
social compartment that he could not do, and it was getting worse. So in other words, people say leave people alone, they'll grow out of it, but you want to watch, right?
Yeah.
Mhm.
But he got to a point where he couldn't go into a party and then would vomit, but he wanted to go. So it's not just shyness, and it's not, people are introverts, extroverts. How do you get your energy? But that was different.
Well, certainly we could. We've got a lot of questions. My list is growing. And as we're talking, there's more and more. So after the break, we will continue talking with Jeanne Cacciatore, LMSW, who's the program director at Family and Children's Association, Mental Health Awareness Training Program, Safe Observant Senior Program. We're talking all about mental health first aid, and you're listening to Project Independence in You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, and my co-hosts today are Paula Ewell and Otto Lohse. And we're talking with Jeanne Cacciatore, who's the program director over at Family and Children's Association Mental Health Awareness Training Program. We are talking about all the things mental health, and certainly this is why the course is so important, because everyone, whether you're affected yourself or your loved one or your friends, it's certainly something that I think is an important topic to raise awareness to. And of course, we had a bazillion conversations during break. So let's just, in true Project Independence form.
Before we go to that
Yes.
amazing question, I just want to answer the question I don't think we did before about when would you know that your anxiety needs treatment?
Right.
Because we all exhibit that,
Or
right?
would you ever know?
Well, let's talk
Yeah.
about it. So what was there like a definition we can say? Is there some way to explain it to someone?
I mean, I know the answer
Christina
once
knows.
again
You
to
go.
this, guys, because I'm just an
It makes
all-star
me feel
student.
good. She gets a
No, but it's really when it starts impacting your daily life, and
Or those around
your
you.
daily activities and things that you can't, right. That you, right, exactly.
He knows though.
Yeah.
It's work,
Yep.
activities,
Family, yep.
relationships.
Yeah.
Because remember the little analogy about my girlfriend who has merge anxiety and
Mhm.
doesn't want to get on the parkway,
Mhm.
but it's not interfering with her life, and
Yeah.
she's very comfortable, and it's not
Right.
upsetting anybody in her life or
Except
herself.
right.
Right? This other gentleman has merge anxiety, but he takes 2 extra hours each day
Yeah.
to go home, and
Mhm.
he's got 3 kids and a wife. Guess what that's disrupting? So
Yeah.
how much are the behaviors
Right.
interfering with life? That's when people need to do
Mhm.
something. And I'm not here to tell people do this way.
Right.
It's a partnership, because there's a lot of different treatments out there.
No, and I think that's what's important to really hit home about this course is, we're not, diagnosing people and then when you take the course or, telling you need to do A, B, it's really kind of what's available out there, how to kind of navigate things that you think, and on the show, Jeanne, we always say golden nuggets we love to walk away with. And that course really was just jam-packed with so many golden nuggets as well. So I really recommend.
I have a bunch. I wrote
Yeah,
down.
go ahead.
One of the questions that we did talk about during the break is we're addressing seniors now, and I read statistics like males 75
Yeah.
plus are the highest death by suicide in any group. That counts me in
Yeah.
by plus a few years. And you have to ask, I asked myself, is this something that was a long-term issue that this person was going through? Or is this something that just developed, emerged in later years?
It's a great question, Otto, and I'm really happy you asked it. The typical and the most common emerging mental health disorders for the older population are anxiety and depression. And for the reasons that we all understand, right? Someone's losing their families, they're losing their friends, your body is not acting the same way.
Losing independence.
Yes, maybe some isolation. COVID was horrible for our seniors. Lack of being able to work around technology can be an issue and a frustration. We do have a program for that at FCA, but anyway, that's a side. So I always bring out that and there's a term out there, and language is so important, but let's just talk about the spectrum of mental illness, and some of the more debilitating and some of the more severe mental illnesses typically don't emerge later in life. So like schizophrenia, like bipolar disorder, they usually will have shown signs early on, but that doesn't mean the person got the correct treatment or got any treatment. So they could still have it later, but you probably would have noticed it. So I have a client whose daughter was exhibiting psychotic behaviors for 5 years, but she's 48. So I said, you never noticed anything before 43? No, not really. My first question, and I'm not a psychiatrist, but I said, is she using substances? Oh, yeah. So that kind of told me that that's probably substance use induced. Now, when you get to somebody like my dad, who went into the hospital, and he told me that he wasn't in the hospital, he was in jail, and I needed to come and get him out, and he's not staying. I talked about the feelings around that instead of telling him, no. Right. This was a medical induced psychotic break because of an infection. UTIs are they many times, and they're very common in the older person.
And really have serious effects in so many realms of things. Until I started working with seniors, I never realized, you would hear, and then, even dealing with my own grandparents, and it was such, it would rock, a situation like the UTI, and especially when you shared that story about your father, I think, and it's, if you don't recognize that, you think, oh my God, what's going on here, so it's really just important to know.
Dehydration.
Right.
Those things are
like
listed.
you're losing that sense of I'm thirsty, and
also like my mother-in-law, who's also, she's still here and she's going to be 98. My dad just recently passed, but she had a pain medication that she was taking that was too severe, and she was getting up in the middle of the night and hallucinating. But as soon as you stop that pain medication, so it's not a neurocognitive disorder, and it's not a mental illness. It's induced by a medical issue. And the average person doesn't know this. And when another time when my dad went to the hospital with signs of psychosis, the doctor stared writing dementia as a diagnosis. I think that's
very common.
Yes, I had, and then when he was going to be discharged back to his assisted living, they said, oh, dementia? He has to go to dementia care. That's going to be X amount of dollars more every month. I said, whoa. They stopped the infection, and he's stable. He's back to baseline.
Right.
He doesn't have dementia.
Right.
And the doctor said, guess what? Okay, I'll take it off.
Well, that goes back to the words you used earlier about the right help.
Yeah.
You need the right help in terms of somebody who's going to take the time to really look at your medication situation. And, and unfortunately in today's medical system, a lot of doctors don't have the time because they get pressured to see as many patients as they can see in a given day. So that goes back to what we've talked about on here a lot of times too, is that you or your family member or your caregiver has to get educated as well. And they have to, we're not doctors, but you can get smart enough to learn to help the doctor, if you
You're
will.
so right, Otto. I even know my dad and my mom would say, well, the doctor said. I'd say, well, why you have to do
Yeah,
that?
right.
Oh, the doctor said. They never
Right.
questioned things. It
Yeah.
was because
Well, that's
the
how it was.
doctor
When I
said.
was a
Yeah, I
kid,
know.
that was it. The
Yeah.
And
doctor
meanwhile,
said,
doctors disagree sometimes. And
Yeah.
I had a bad back surgery, and one doctor said, it's like artwork. It's not science. I'm going to do it this way. I'm going to open you and take your organs out.
Right.
And then
I don't want to be artwork.
I went to another specialist. He goes, no, I have a little scar down my spine. And he did his stuff. But going back to something else, I don't know. Let's move on. I might have a little something.
That's all right. You got
Well,
so much
no,
good
but
knowledge.
This is
in
a
that,
good
yeah.
thing to bring up.
Yeah.
Forgetfulness is a
Yeah.
normal part of life.
Mhm.
Okay. I find it even in my kids.
we know.
When
Because
do we
there's too
know-
much going on. Yeah.
When do we know that needs attention?
When do we know?
When do we know if our forgetfulness needs to be diagnosed or give attention?
When it's happening frequently, I think, and when it's happening on short-term stuff, like over and over again. Like if you forget the same thing like 3-4 times in the last hour,
Okay.
I think, I don't have a definition.
Well, let's use the barometer we just used.
Yeah, okay.
And I make the little acronym WAR. Is it affecting your work, your activities, your relationships? So when the forgetfulness starts to interfere, you might want to look into it. So if I forgot the name of a movie,
No
we
big deal.
forgot, right? It's also when you forget that I take this cup and I drink from it. I don't know what it's for
Right.
or something.
Right.
That's getting into
That's
more
Yeah.
severe.
Yeah.
Yeah,
Function of keys or,
exactly.
yeah.
You tried to start the refrigerator with your car keys.
Right, yeah.
No, but I think that's why it is hard. It goes back to our original point of, when you're not sure what's going on, because, you hear all these things. Oh, that's a normal part of aging. Oh, but like certain things, and as we said, it's important to clock that and your loved ones to also clock that. And I like the little acronym WAR. I'm going to write that down.
Yeah.
I like
There's
that
our
little,
golden nugget.
yes, there we go. I'm going to
I
add
love
that. I'm
golden
gonna-
nuggets. They help me.
I'm going to add that to our list.
I had an interesting experience with our attorney. We were redoing stuff, everything. And he said, I want you to draw a clock.
Yeah. He
Mhm.
started a mini mental.
Yeah.
Yeah.
And it was interesting.
Yeah.
Because somebody who I was with had a
Yeah.
problem drawing a clock.
Yeah.
So
Yeah.
it's a simple
It's a
exercise.
basic.
Right.
Yeah.
Right. But it definitely shows
Mhm.
something.
So as you asked earlier, what are the things we touch upon? So I started to talk about psychosis. I started to talk a little bit about things that affect seniors. We do a dive into depression and how to recognize it. And then we watch a film on it, we talk about it, and there's some very blatant, unhelpful things that this gentleman's son was doing that weren't helpful, but had a, and not any fault of his
Right. He
own.
just didn't
Just be-
understand what to do.
Exactly. So then we talk about those things and we do a suicide assessment and a little activity that gives people a little bit more practice, so to speak, on how to approach that subject, because it is scary for some people to have to even talk about it. So if you don't mind, I'm just going to give you the quick
Basic
little
assessment. Yeah.
suicide assessment. If someone or is experiencing or showing signs of depression, you really should ask them blatantly right in there, are you thinking of killing yourself?
Mhm.
Now there's a myth out there that that's going to put that in someone's mind, but that's not true. The research shows that it helps lift the burden when someone gets that, how severely bad you're feeling. And then if the person says yes, what might you ask? I know my ladies know. Would you know what to do if someone said yes to that, Otto?
I think now I would. And I think I probably would have, because I know there's like not people we've had suicide help numbers that people could
Okay.
call. But that doesn't mean I have it like right on my fingertips.
I think
Right.
it's, well, it's
Yeah,
like,
right.
it's
I would have to call
asking if you have,
Kristina.
well, it's asking if you have a plan,
Right.
Yeah.
because you have to, and I actually had to, shortly after the class, one of my friends was going through something with a family member, and it was a suicide. She was scared because he was saying she didn't know if it was a 10, so she was very stressed out about this, so I pulled out my, my manual. I did, and this was really shortly right after, and I broke it down with her. I said, I know it's extremely uncomfortable to like straight up ask someone like, are you thinking of killing yourself? It's just to even like say that, and we in the class we had a practice saying that because it's like, some of us, and we're professionals, are giggling because you're
Right, it's never
uncomfortable
people
because
make
you don't know,
mistakes.
it's a very
Some
But,
doctors will ask that question though when
well,
there's,
that's great
They
that's
should.
becoming
you know,
part. Yeah.
I don't think
screening
we were
going.
trained as well either.
Yeah.
Yeah.
Like when we were going through school, it was kind
Yeah.
of like specified, like
Right.
here's like what you're doing.
Right.
I
Right.
don't think
No, that it was
really,
like yeah, integrated in the whole
No.
thing. But when you really ask someone like, do you have a plan? Have you tried this before? Have you tried it? Like you really have to make it so concrete in the conversation, to kind of gauge where they are, if it is, something that
And
needs further
reality is a lot of people react different ways, but some might say, yeah, I was thinking about it, but I better not do that.
Yeah.
But they
Yeah.
might, so again, Kristina just said was, so you ask the question, if they say no, you still want to.
Yeah, right. You don't say, okay, great, right. Yeah.
To get some help, but it's
Yeah.
not a crisis.
Yeah.
But when the person has a plan, and not only a plan, and access to the
yeah.
plan
Right.
with details, that becomes
Yeah.
an imminent crisis.
Yeah.
And that's when
911.
you don't want to leave that person
No.
alone.
Yeah.
You want to get them that 988 number. And I always say, go by host settings. If you're in a professional setting, you have to do what your host,
do.
you're
Right.
trained to
Yeah.
do, and the
Yeah.
proper protocol, and maybe call 911. But there are lots and lots of suicide trainings out there that are giving some more alternates. And there's something called QPR that I could put people in touch with. And that's question, persuade, and respond. And I know a trainer who does that virtually, free also. So anyone that wants information on that.
Time for a couple of quick administrative questions about the
Sure.
program. All right. One, is there a cost for the program?
Nope. You
No.
actually,
No cost.
you
Free.
actually get an opportunity to get $30 gift card for taking the course and giving feedback down the road.
Okay. And
You can make
how
money.
many people are typically at a session?
Okay. I can train up to 30 people. And I've done as little as 5. I'll make a course, and who signs up comes and
I might have a family plan.
yeah.
No, bro, I think even
Yeah,
so.
no,
Yeah.
And
Yeah.
the next part of it is then, how would you go about signing up, and how would you know when these programs are? How do I find it all out?
I have a flyer. So some people find us on the Mental Health First Aid website,
Which would be,
which is mentalhealthfirstaid.org. But then, and you can put my name in if you want to know my classes. It says, find a class, find a course by instructor, and you could put Jeanne Cacciatore, and it's spelled just like the chicken.
mentalhealthfirstaid.org.
Yes.
Well, I saw you on
And-
LinkedIn and I saw you on
Oh.
Facebook.
Okay. Good. So then also I have an outreach list of about probably 1,000 people, and we give our flyers out in the community, and anyone to get this registration started, you have to start with an email to me. And you get a certification. You get a certification certificate saying you took the course. It lasts for 3 years. And people like putting that on the resume, or, showing their,
You have Jeannie's.
Yes.
Yeah,
And anyone
yeah,
that's
yeah,
watching
geez.
this on
Jeans.
video, at the end of the video, they'll be up, but you could always call 311 or 516-869-6311, and we will get you in contact with Jeannie, because I really do. I think it's so beneficial for everyone. And I like the idea, Otto, of like making it like a family affair.
Well, it's something like if
Yeah.
if you haven't had some exposure, you don't get it. All right.
Yeah.
There's a lot of people that still have the attitude that, you know what, just,
Yeah.
handle it,
exactly.
I think they
Snap
should-
out of it.
Yeah,
They should
you know.
teach this in, if not high school, college.
Mhm.
It should be like a requirement
Yeah.
somewhere.
I think so.
I
It actually could
absolutely-
start out very young,
Yeah, I
frankly,
mean,
financial and
11th grade.
mental
Yeah,
health.
yeah.
Yeah.
I mean, basics. Yeah.
And I also think, and I think some schools are doing it, is learning to cope, because so
Yes.
many people go to drugs and alcohol and substances to soothe themselves because
Yeah.
of mental health issues, and anxiety hurts. Let's be real,
Yeah.
right? No one likes the way that feels.
Well, there's a lot of
coping.
vaping.
Yeah.
One of my granddaughters is a social worker who they know
Yeah.
out of high school.
Yeah, it's tough.
And vaping
Job.
Vaping
Yeah.
is big.
is a
Yeah.
big deal.
Yeah.
Now, that's not necessarily connected to mental health, although it
Well,
could be.
Yeah,
All
it
right.
could be. You don't know.
It's
It's a
not a-
right?
negative coping skill.
Yeah.
Yeah.
It
And
Yeah.
could
when
be.
people
Yeah.
are,
No, go ahead. No. Yep.
When people are engaging in negative coping skills, we just don't want to pull that away from them and say, bad, bad, no, no. We want to say, wow,
What's going on? that
what's
you think you need
happening?
this?
And
Maybe we
replace
can
it.
help find something more positive to replace that nice feeling you're getting from whatever it is that you're doing.
Yeah, I mean, there's a lot of reasons why I guess people do that.
Well, trauma,
Yeah, you know.
that's a whole nother,
Yeah.
we go down the road of trauma and trauma on the brain.
Well, you know, and back to the older circumstances, you use the words health conditions and life circumstances that are tough to deal with. There's a long, long list as you get older. And you really have to work at contending with these things.
Yeah, and we're going to dive into that because after the break, we'll continue talking with Jeanne Cacciatore, who is the Program Director for Family and Children's Association Mental Health Awareness Training Program. We're talking all about mental health first aid. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts today, Paula Ewell and Otto Lohse. And we are talking and about so much with Jeanne Cacciatore, who is the Program Director at Family and Children's Association Mental Health Awareness Training Program and the Safe Observant Senior Program. We are talking about the mental health first aid training course we did, and Jeannie's graciously giving us a lot of little tips. And of course, to really dive into this, you should sign up for the class because it's 6 hours. So we're trying to cram it all in our hour. But the course that the overall kind of theme that kind of goes through the course is this ALGE is the acronym plan. So I would love to just touch upon what each of that means. And I think it's a good guideline for people in general in kind of approaching this.
Okay, so it's a wheel. And the whole concept is to assess the situation. So how do you do that? So the A in the ALGE plan, well, let me even say this. This course was started in Australia. And then it came in about 2008, it was brought to the United States. So the ALGE acronym was created by the mental health first aid creators. So it's to approach, the A is ALGE, approach the person. But how do you do that in a helpful way and not turn them off? The second L, the second letter is L for listen non-judgmentally. Now, I think we could all agree how important listening is, but non-judgmentally might not come easy for all of us as human beings. We're human beings. G is give reassurance and information, and it's different from advice. We go delve into that a little bit more. E is for encouraging professional help. And the second E is for encouraging self-help. So that little plan doesn't need to be done in order. All the steps don't need to be done all at once, but you can pick and choose. And we watch a video again. Are they using this ALGE plan or not? So we're bringing home some of these
You know, there's some interesting things in there, like give. A lot of people are great at giving advice, all right, but to follow the advice, they don't follow the advice that they get, but they are very good at giving advice.
Right. They say if you can't do teach.
And there are a lot of people who listen not judgmentally, but with judgment.
Well, I think just touching on that, what are some tips for people? Because I think even obviously it's so important in dealing in a mental health situation, listening not judgmentally, but just living life as a human. You know, I think it's something that's so important, especially in the climate that we're in with everything. So what are just some tips to listen non-judgmentally?
Well, first of all, let the person explain and listen. So reflective listening means you give back to the person what they said, maybe in a different way. You make eye contact. We talk about the head nodding, which is a good thing, but not if you're going like this the whole time. And that person's like, oh, they don't really want to hear me. So that's make sure that they know that you care. There's a sincerity, there's the nonverbal language, but also to not be judgmental. I'll just give a simple analogy. And so there's two women there in an assisted living. They both lost their husbands. One's playing mahjong and bingo, and she's going to the next phase of her life. But the other one is still mourning. Does the one who's joined in get to judge the other person? I got over it. You should get over it too. Those are the kind of things we have to avoid. Everyone experiences things differently. And that judgment of our own experience. Now, that person is probably meaning very well, but they know that they could do it.
Right.
But that person's not there yet. So how do we give them reassurance instead of advice? You could say things like, hopefully, if you start doing a little bit more, maybe this would happen. What are things that you might enjoy that you didn't get a chance to do when your husband was alive? Maybe I can help you with that. Letting the person explain to you, not just giving them a litany of things that worked for yourself.
Well, mourning is a really good example because everybody
hard.
grieves in a different way.
Exactly.
And people a lot of times have a problem understanding that.
Yeah.
You should grieve how I grieve. Well,
And it's okay however long it takes.
yeah.
Right.
There's no magic book on that.
No.
Or 9/11, someone could have walked out of that building, wiped the dust from their shoulders and said, I'm moving on. And someone else, like myself, who watched it, was a little traumatized by that. So again, you can't say, well, I walked out. Why can't you? Again, and that's with everything, like the merge anxiety. Like I could drive through Manhattan streets like nothing. And I don't say to my friend, well, I do it. You just get in there and do it.
No, and it's hard. And I want, anyone listening to realize that is that, this is difficult, right? Because, and I'm glad you said, Jeanne, a lot of times you're not approaching a situation like with ill intent.
Right.
You think you're being helpful. And I know even, in being trained this, sometimes you have to check your own self when you're dealing with your family member or loved one, because we were laughing near the break saying like, all this like goes out the window, when you're dealing with a personal situation, because there's just so much emotion involved and it gets so complicated. But I even remember, and I've shared this on, my brother had, anxiety severe when he was like in his senior year. It was a senior year of high school. And it was like very bad, and I mean, he's gotten therapy. He is like, it's great, and we always say like James is good, and he's got just a very low dose, but he really actively worked on it. And my brother's such a good person. We're 9 years apart. He's such a good person to go to when I'm experiencing, I could be a little anxious. And
the lived experience.
But it is, and I remembered like, it was very hard, and especially like my dad, he didn't understand, what was like going on and stuff. And, I remember it was his graduation and he didn't want to he couldn't get out of the car. My dad's like, get out of the car. Like, what are you doing? Like, just get it over with, enough, and it wasn't. And then until the therapist had said, it's like telling someone with a broken leg, go run.
Right.
Just go run. Right. And that was like, oh, okay. Because you needed to, if you don't, that's what you were saying, if you're not experiencing yourself, it's very hard to get what's happening in that person. So I think it's to learn these kind of tools for your toolbox are so important because you don't know unless you lived it. You really don't know what could possibly be going on.
Well, I mean, it's a trite statement, but until you've walked in somebody else's shoes.
No, but it is. Really, it's a very right.
True.
But I'm going to piggyback on that because we go into detail with this as well. Having that comparison or that ability to share in someone's experience can be slippery slope.
Yeah.
Because you want, we use that word exactly.
Yeah.
And we have to say that no one can know exactly how you're feeling.
Right.
So if you're going to use
very true.
and introduce your experience to someone, just be careful to let them now focus, say the focus on that person, because people take their experience and then sideline it. And then it's all about what they did.
That's so true.
Yeah,
that's very true. Yeah,
some
that's
people
very
are
true.
professionals at
Yeah,
that.
that's very true. Yeah. We
I'm
might
sure
know
I've
a
done it
few.
myself. I mean, again, people think that's helpful.
Yeah.
And maybe it could be, but I would.
No, but I do think it's a fine line. No, that's such a good point because
but it is helpful for them.
Right. Exactly. And that's why our lived experience peers really study that and how to maneuver and navigate that without bringing it back.
But that's why
themselves.
I think it's so important. It's important to constantly have these, conversations and certainly take these kind of courses because I think, and as I mentioned before, you're constantly need to check yourself because there's a lot of times that, you know, there's certain things you could say to someone like, oh, I know exactly how you're
Yeah.
feeling. I get it. But you're trying to be supportive, but you don't really, you know, so it's like these little kind of words that are ingrained in us.
Well,
You know, it's a
actually,
hard thing to do.
You'll say, no, you don't know.
Yeah, right.
Yeah,
right.
yeah.
You
Right.
could say I had a similar experience,
Yeah.
but how does it affect
Right.
you?
Right. And it's
Right.
not everyone can listen and, you know, with empathy, and some people just change.
Yeah.
Like if they're starting to feel a little uncomfortable with what you're sharing,
Mhm.
the channel gets changed immediately. Then you're on a
You know,
whole other topic.
Yeah.
I
And
was
then you
in
can just take
sales
it
all
back.
my life,
Oh,
all right, and I
right.
used to be, and I got to be a manager and whatnot. And
Mhm.
we'd go on a call and we'd go back outside, and they'd say, "Hey, well, how'd the call go?" And the person would say, "Oh, I thought it was really good." I said, "It was really terrible." I said, "You never shut up, and you never listened. That person, they don't drink water. They didn't need water." All right.
Yeah.
You know, there are a lot of people who are in that world that don't get it either.
Yeah,
Right?
yeah,
They don't,
yeah.
they're so busy talking that they don't hear what the other person's trying to tell them.
Right.
And listening in sales is a very important.
Well, and also we were
uh,
taught by our very own Wizard of Oz, Dan Cox, that in doing radio, we
Yeah.
need to, as hosts, let the
Listen
guests,
more.
right? Let the guests speak. So, you know, I feel like that has actually transitioned, you know, because my family can be a family of everyone want to get their opinion
Right.
out, you know,
At the same
everyone's
time.
excited. There's a lot of hands going around. But it is, you know, to step back and certainly
And that's
to
a good
listen.
point too, by the way. We do have to
Yeah.
be conscious
Yeah.
of that.
We hired someone new about a year ago, and she's a great listener, and I notice everyone wants to go talk to her because she's a great
Yeah.
listener.
Yeah.
It's a true
It's
statement though,
true. It
because
is.
I laugh because, you know, I'll be out with my friends and there'll always be someone, right? And I was like, they could smell the social worker on me. You know, it'll be like in a grocery store. And there was one day I was just like literally going from aisle to aisle. I was like, I'm just, what's happening here? You know, but it is, I think it is something that is, you know, you kind of give off into the atmosphere. But Otto, you had also mentioned during the break that there's a thing called Turquoise House, and I would love to kind of touch upon what that is and how you can get in touch with that.
Okay. So Turquoise House is the name that's given to a mental health and or substance use respite house. And it is staffed by people that we just talked about that have the certification to be a peer. And it's a house that so you don't live there permanently. It's a respite. So you call them and they do an intake to see if it's a fit. And you can go there for 7 to 10 days. There's like I've been to one of the houses. It's a living room and a kitchen. It's a warm feeling where people are going to be able to get support by other people who truly understand what they're going through. They're not going to give them medication, but they'll help them if they do need medication and they want to go that route. So you would call, do you have the number on your flyer there?
You know, I
Yeah.
thought that there was.
I know I have it. It's,
I have
I'm
10,000
sure
flyers
it's
here.
489. Anyway, I'm going to get that for you.
Here we go. It's 516-489-0100 extension 2.
Yes. And
And you
that,
could call 311, obviously, and we could always give you that.
Unfortunately, we've had some exposure to this as well within my family. And is this something that is covered by any insurance?
you know, I think it is Medicaid now,
Yeah.
but I don't know, because when it first started, it was granted and everything was free. So some of it has changed. I used to work for the agency that launched it, which is the Mental Health Association of Nassau
Yes.
County.
Mhm.
And so those questions, I think, will be better if the
Yeah.
person calls them. But again, the host of that Turquoise House is Mental Health Association of Nassau County. There are 2 Turquoise houses, 1 and 2. So they did expand.
Yeah,
I
that's
think
great.
it's a wonderful idea. So in other words, when a person feels that they're getting symptomatic with their mental illness, but they know they don't want to go back to the hospital, but they know they need to get out of the environment they're in and just get some support and get back on track, they can make that make that request to stay there. It doesn't work for the person whose loved one is experiencing a mental health challenge and doesn't want to go, because you have to want to go.
How
Right.
long, like, I'll use a live example, all right? Somebody takes, for the first shot, mushroom, and it's got fentanyl in it, all right? So now this particular person winds up with a big issue, and you need to instantly do first aid, all right? With a situation like that. So they end up over by Zucker.
Hospital.
Zucker,
all right?
yeah.
I was going to say 911
Yeah,
is the
911,
real,
Or
yeah.
911,
Yeah.
Right.
yeah. Luckily, this person now is doing great, but learned a very hard lesson. Only need to do that stuff once, and
yeah.
can have major problem. So my question is, would like a respite house like this, is that something that, you just say, okay, my friend, somebody has a problem. How do I get them in there? Do I have to go through another agency or a provider or?
The person themselves has to call.
Oh, really?
You can't put someone there.
Right, because they have to
Family can't
want to go,
refer.
right?
Yeah.
Okay, so this person in this case would have to been sort of guided to hopefully do that, because the person who's in those shoes probably doesn't have the ability to think this through on their own at that point.
And this is a whole nother course that we can talk about.
Oh, okay.
It's been a very big part of the field that my specialties have become working with the families.
Yeah.
Should I mention SOS? Or?
Yeah, absolutely.
Okay.
Certainly.
So the other hat I wear is in the Safe Observant Senior Program. And we get our referrals from the DA's office. Most of them, they don't have to come from the DA's office, but many times, so it's an elder abuse victim services program. So 90% of the defendants in the cases that we get, it's their older adult child or grandchild or loved one who is experiencing mental health challenges and or substance use. And the older adult now can't live in this scenario anymore. And it becomes abusive. So they might call the police because they've tried so many different ways to get their loved one help. So that book, I'm Not Sick, I Don't Need Help, is a very big guide for people. Yeah. And there's another book by Judith R. Smith called Difficult. She has encapsulated.
That's it, difficult.
Difficult. Yeah. She has a little ... like mothering challenging adults through difficulty, something like that. But Judith R. Smith, Difficult, you will find it. It's absolutely, there's no silver bullet answer for this, everyone.
Yeah.
I want to be clear about that.
Yeah, but it gives you some guidance.
Yes, it does. And it makes you feel less isolated. Yeah. It's a very big issue. Yeah. We have over almost 700 clients that have walked through our door since 2019. So it's more than 100 per year. And
Jeanne, I'd like to, if anyone wants to get in touch with you, what's the best contact way? Because I'd love to.
There's two ways someone can contact me. So it's my email, which is JCACCIA, T as in Tom, ORE, and it is just like the chicken. So those are C's like cat, at F as in Frank, C as in cat, A as in apple, li.org, or feel free to call or text my work cell, 516-619-6786.
Great.
I'll be happy to hear from everyone and anyone, truly.
Now, if we wanted to sign up for your training program, it could be done through this email.
The email is the best way, because I need an email to even start, but people need to know what day the training is. So if you're on the website and you see the trainings, email me with the date and I'll get it started right away, or ask me for the flyer with dates and I will send that to you.
Okay. It's all good stuff.
Yeah. I mean, we have, as Kristina and Paula know, and I think Otto knows, we have a slew of senior programs at FCA.
Yeah, it's really, we talk about a lot because it's such a great partnership since Project Independence has been around. And, you guys really have such an extension. It's just this, and you touched upon the smart van earlier.
Yeah.
I just booked us 2 more dates for the fall. So we will talk about that in the next segment. So, really a great, and you guys have your finger on the pulse of what new programs and what's important, which is really, really
FCA,
great.
as I understand, has a lot of other programs. The one that I've heard about is for dementia specifically.
There's caregiver support. Thank you, because I really wanted to mention that. That caregiver support group is amazing, because not only does the caregiver can travel with the person who has the memory loss. So it's anyone who's giving care to someone with memory loss. They can both go to the same location, and as long as the person with memory loss can participate in a group,
Yeah.
they could go to a group and the person could get respite support as a caregiver, but they can travel at the same time.
Yeah, so
So
But
it's
that-
very cool.
That person could also sit in with the care group, depending on their,
I'm not sure if they needs to be
No.
separate. I
Yeah.
think it's a separated group because
Okay.
people need a
think so,
chance
too.
yes,
to
I feel like they
feel
can,
Yeah.
right?
can,
Right.
can vent their
Mhm.
frustration or,
It's like
you know.
our grandparenting respite.
Yeah.
Similar.
No, and that's why I was thinking, and that is something certainly in our field, hopefully, there'll be more and more services, are these seniors who are taking care of their adult children or their grandchildren now for, various circumstances. And it's like navigating a whole new world, especially when it's your grandchild because of like, the gap of things and how things are different. So,
yeah, I mean, seniors get involved with, in some cases, their family. You really don't want to.
I know it's tough. And this is why everyone should sign up for Jeannie's mental health first aid class, because we could really talk about this forever. We would like to thank our guest today, Jeanne Cacciatore, LMSW Program Director for Family and Children's Association, Mental Health Awareness Training Program, Safe Observant Senior Program. We would also like to thank everyone today who's joined us and listened. You're listening to Project Independence and You on LIU Public Radio.